So these were some of the psychological symptoms that I went through, and I said in the beginning, you try everything. You try conventional medication, you try antidepressants, seizure meds. These were some medications that helped me in the beginning. I don't know if many of you know, but I've been trained as a pediatric neurologist. That is my core training. So my medical training always goes back to allopathic. And, especially dealing with all these symptoms, having ADHD, OCD, being a little bit manic, emotional lability, phobias, anxiety, even being suicidal. So we tried these, that helped. Do patients with Lyme disease here, do they experience dental issues? Or has anybody correlated borreliosis to dental issues? Not yet. There is a specific strain of Borrelia that affects the dental tubules. Dental tubules are, at least a couple miles long, if you know. And of course, there is nutrients, there's food and nourishment. And borreliosis affects dental tubules. It stays there. Then there is another factor called as marcons that research has shown to affect the jawbone development and also infect the jawbone. We will talk about this a little bit later, when I address the biotoxin illness. So yes, I had a 25-pound weight loss, and I required straw feedings, couldn't open my mouth to eat. Honestly, after removing my amalgams, my silver fillings in my teeth, doing some ozone shots, that was a really big relief. Huge turnaround. Okay. Now, after all that, I still had insomnia, night sweats, frozen shoulder, urinary frequency, intermittent diarrhea, wrist pain, back pain, eczema, easy bruising, foot pain. Those of you that have been through it, it's very, very difficult to get better once you reach that stage. Okay, so how did I get better? And I like to use my personal experiences because, most people can relate how I got here. And it also helps to kind of, tie everything in together. So yes, I had to do it all. We did allopathic, I did herbs, oral antibiotics, homotoxicology, homeopathy. We did pulsing of antibiotics. You have to understand that Lyme disease was still in its developing stage. Like myself, few other patients, few other physicians that I know that have been through borreliosis, our children, we were all guinea pigs in the beginning. We didn't know what works. This is like years and years of trials on ourselves and our families that we have gotten these allopathic and holistic protocols. If even Stephen Buhner, if you see him on a daily basis, it had been a tremendous struggle for him as well to be able to get through borreliosis, massive lung infections, nearly died, but we all kind of, we all, not only did we survive, we also thrived. And here we are, with all of these protocols that will be helping, millions around the world. So pulsing of antibiotics and herbs. Keep in mind, pulsing is also applicable to herbs. If anyone wants to, come and meet me or email me or something, if you want to know more about how to do pulsing with natural protocols, you're more than welcome. I'm happy to share. Spirituality, mind, body, spirit, consciousness. That is what helps to move you to the next level. You need to keep that in mind. You need to believe that you are going to get better, and that is what keeps things at bay. Borreliosis, there is no cure. There is only remission. The Co-infections, once Borrelia goes into remissions, co-infections are relatively easy to treat. But spirituality is what got me through. In fact, spirituality is what makes me travel all over the world. I mean, I'm not 100% yet. I'm about 85%. So, because I focused on trying to heal my son. And so now I'm able to focus on myself. He's 15 now. He's fully recovered from autism. It was completely Lyme-induced. He's in pre-med right now. He wants to help children not go through the pain that he went through. So he wants to be an MD. So we are, helping him do that. But yeah, both of us, my son and I, have had a tremendous spiritual growth. We've had Kundalini awakening. I've had 2 Kundalini awakenings, and it's been quite an amazing journey of faith and meditation, and believing that I'm going to get to the next level. I just find it amazing that I'm here today. Like 5 years ago, I had no clue that I would be traveling and meeting so many amazing people and practitioners that have all been through, almost everybody has been through what I've been through. You guys have seen patients that are going through some very difficult times. Okay, so what did I learn? When you're in bed like 12 hours a day, there's a lot of time. So, either you can sit and groan and moan about it, or you can learn. So this is what I learned. Okay, so this is your classic, right? What is Lyme disease? Often misdiagnosed, but this is what it comes up as: fatigue, flu-like symptoms, bullseye pattern rash. Bullseye pattern, what I find, is not really seen in more than 30 to 40%. Everybody looks for the classic symptoms, and they are usually not even there. Okay, these are what I see in my practice as acute symptoms, right? You see the erythema migrans rash. It is an expanding red circular rash, also called as bullseye. Flu-like symptoms, it's very interesting. It was 85 degrees outside, 85 degrees Fahrenheit, and I'm at home, shaking, shivering. I have the flu, body aches, runny nose, and it did not even cross my mind that, hello, why do I have flu in the middle of summer? But it was actually Lyme disease. So with or without the rash, I did not have the rash. And, I'm just an example. Most of my patients are what do you see in front of you, right? Lack of energy, headache, stiff neck, fever, chills, muscle and joint pain, swollen lymph nodes. Now, the joint pains that I see in my practice in Lyme disease is mostly knee joints and joints of the hands. The small joints of the hands, often misdiagnosed as osteoarthritis or rheumatoid arthritis. So in some cases, people don't notice any symptoms during this stage. Especially women, unfortunately. Us women need to be much kinder to ourselves. We are the first ones to make excuses for ourselves. Lack of energy, maybe, I'm stressed. Maybe it's the kids. Maybe it's wrong time of the month. That is almost everybody's husband's favorite. Oh, that's the wrong time of the month. Stay away from her. So headache and stiff neck, fever, chills, or maybe it's just, a cold or a fever. Especially us women going through stages of life. Young girls going through puberty, everything is labeled up as hormonal. Older women going through menopause or even perimenopausal, all of these are just put aside that, this is what I have to go through. And it's probably my life cycle happening. And that really isn't, like I said, us women need to be much kinder to ourselves. We need to look further. Every symptom we have, we need to think about it a little bit. I've had many women come to me and say, you know what, I eat healthy, I'm exercising every day, and I still cannot lose weight. Forget about losing weight, I keep gaining weight. So what is going on with me? And that is, a very important aspect. Not being able to lose weight, you keep gaining weight, brain fog comes in, and of course there is psychological situations that arise in there, and this really doesn't need to happen. It's just some labs that have to be done. Go see a good holistic practitioner that can help you with all of these changes. Most of the women that come to me with that scenario, and I find that they have a healthy lifestyle, underlying it's usually either borreliosis or biotoxins. And we'll learn a bit more about this. All right, so moving on from the acute stage. So early disseminated infection. Disseminated means it's traveled to other organs in the body. Right, you get more rashes, pain, weakness, numbness, neuropathy starts to set in. Many patients have the facial palsy on one side. And you go through not being able to use the muscles of the face. It's usually unilateral or one-sided. Poor memory, lack of concentration, visual issues. I've had patients come in and say, Dr. Dashore, I don't know how I drove to your office because all I can see is in front of me. On the sides is a complete black. So, they don't have peripheral vision. So I'm like, you really shouldn't be driving. That's a little scary. But, they're brave enough to make it because they're still hopeful. They want to come to me and get treated. So visual issues can also be related to borreliosis. Once you have spirochetes that travel to the brain, they can affect any cranial nerve in the brain, including your optic nerve. Okay. Brief episodes, right. What I find in my patients is that they end up with, when they wake up from sleep, they end up with like swollen fingers, swollen knee joints, change in color. The fingers are red, blue, purple, and it kind of wears off as the day goes on, but that's how they wake up. It's usually related to detoxification issues, and I will talk about those when I get into treatment. So be very careful if your patients have any heart issues, any cardiac issues, because that can result in some serious heart problems.